So today we are going to discuss the worst nightmare every woman faces. Yes, is when things go wrong in pregnancy. Statistically, 70% of women encounter certain problems before their delivery time. It could be feeling nauseous in the first week of their pregnancy or pelvic pressure in the last week of their pregnancy. These factors that can cause problems in pregnancy include diabetes, heart diseases, high blood pressure, rhesus factor, isoimmunization, and other factors. So these problems we are going to discuss today, I categorize it into three. One is bleeding, yes, or miscarriage. They are oftentimes interchange. When this occurs between the first week of pregnancy, it is called abortion. This miscarriage is spontaneous removal of the embryo before it is being matured. So some of these can be caused by factors we contribute ourselves, like the lifestyle we live. It can also be caused by uterine incompatibility. This case you cannot control it. Then it can also be caused by infection. That is why any type of infection you're experiencing during pregnancy stage should not be ignored. So how can this be prevented? Whenever you experience bleeding through your vagina, you should always visit your doctor. So the second problem when things go wrong in pregnancy is what we call the ectopic pregnancy. This ectopic pregnancy is when the fetus embryo goes to the fallopian tube and attaches itself instead of the uterus. So when this happens, it cannot be controlled. It's not a factor that you did or you need to blame yourself. No, this happens naturally. So how can this be solved? This can be solved by surgery. The doctor perform a minor surgery on you and remove it, or it can also be solved by injection of chemical known as the methotrexate, and nature takes its course by dissolving this um, fetus fetus. So because of that, there is also chances that a woman will conceive after this surgery. So the last problem a woman is going to encounter, or when things go wrong in pregnancy, we'll discuss it. But before then, if you have not subscribed to our channel and you're getting value from this video, I would love you to do us a favor by subscribing to our channel. Please subscribe, help the channel to grow. Rupturing of the uterus. This is when the uterus rupture before time. If it occurs between the 35th week of the pregnancy, that is okay. The woman might decide to be induced and have a baby. But anything less than the 35 weeks of pregnancy is usually dangerous. That reminds me of my experience. When I was around 22 to 24 week, I went to hospital because I was having this contraction. Surprisingly, the nurse said that I'm going to be induced. I was like, why will I be induced? She's like, your pregnancy is up to 7 months, so you can be induced. 7 months, 22 weeks. She said yes, 20 weeks is 5 months, then 22 weeks is 7 months. How is it possible? That was how I left. So this is why it is good to be informed before all these things. So to avoid premature rupturing of the uterus, or if it have happened, you are likely to be giving bed rest. Yes, you have been giving bed rest and some antibiotics so that the amniotic fluid in your womb will not be exhausted, should be returned to sustain your baby before then, if you are not likely to have a baby preterm. So that's all we'll be discussing when pregnancy goes wrong. So if you're